Recovery is light at the end of the tunnel.
Sunshine.
It's remembering who you are and using your strengths to become who you're meant to be.
Recovery means something different to everyone with mental illness.
40 years ago, California drastically cut back its services in state hospitals for people with severe mental illness without providing adequate funding for mental health services in the community. Since the Mental Health Services Act was passed by California voters in November 2004, it has served over 375,000 children and adults living with mental illness.
MHA funding has changed the face of what's happening for peers in this area.
I was living in San Bernardino, homeless out there, still using. My sister found me this place called The Village. Tanya and Cherokee, they helped me get back on my feet. From there, I took it upon myself to straighten myself better up again. I'm a clerical worker. I'm going to school to get my GED. I'm pretty much keeping myself busy, going places with my PSCs.
Where are we going now?
We're going to the Angels game.
Woo!
First time.
Go Angels!
Go Angels. And pretty much I got my life back on track now.
The Mental Health Services Oversight and Accountability Commission was established by the MHSA to develop strategies to overcome stigma and to ensure that public dollars are spent in a cost-effective manner. The goal of the Mental Health Services Oversight and Accountability Commission is to provide vision and leadership in collaboration with clients, their family members, and underserved communities to ensure Californians understand that mental health is essential to overall health. The MHSA is funded by a 1% tax on personal income above $1 million a year. As of November 2009, the Department of Mental Health and the MHSOAC have approved more than $3.75 billion in MHSA funds for California counties. The MHSOAC uses MHSA-funded programs to help with the reduction of suicide, incarceration, unemployment, prolonged suffering, homelessness, school failure, and removal of children from the home. Prevention and early intervention services are focused on all ages. However, by using new digital media and social networking sites, youth and transition-age youth are being reached in exciting new ways.
Our program is designed to do a combination of clinical and quality of life work. So we're interested in what illnesses do you got and how can we help you treat those and learn to take responsibility for them. What issues do you have with drugs and how can you get better with that? What emotional issues do you bring with? We also care about, do you know how to have an apartment? Do you know how to get any money? Do you have job skills? Can you build responsibility? Can you have a good relationship? Are you able to raise a kid so that it's not taken away and start the cycle all over again? We're working on building a lot of responsibility and a lot of skills while you're here so that when you're 25, you can be part of the adult world and be contributing even if you continue to have serious symptoms or a serious mental illness.
I started getting suicidal at the rehab, and so they decided to send me to TAY. And since then, I'm not suicidal anymore. I'm not homeless anymore.
I just kept everything in and then explode, but I'm working on that now, and staff are really helpful with that. I'm looking to get back into school, and then once I graduate and everything, I'm going to take training classes to become either a youth advocate or a probation officer.
People skills, how to remember things, to forgive people, to respect them. And no matter what, if you want to be something you want to be in your dreams, you can do it. And that's what Tay did for me.
Drop-in centers for transition-aged youth provide them with guidance and resources.
I haven't, if I wasn't here, I wouldn't know the people I know today. I wouldn't know my girlfriend. I wouldn't know Megan and Trisha. I wouldn't know the other staff members here. I wouldn't have no fun. I wouldn't have a job. You guys helped me get, stay in the motel I was in, yeah. But at the same time, the apartment that I'm in now, I found it by myself.
Prevention and early intervention services are needed by all ages and ethnicities. To address these needs, PEI services are being made more accessible to those in need. As of November 2009, the MHSOAC has approved 48 PEI plans for over $337 million in approved expenditures. Workforce education and training is designed to grow and train a qualified workforce to provide mental health services.
About 2000, life was great. worked, had children, still have them. My husband worked for 10 plus years electrician, and then that's when I got diagnosed with bipolar disorder. I was trying to work through the recovery process alone with my family and just with my physicians. Kind of got in a really stable place in recovery, got an opportunity to go to the Department of Rehab, and they sent me here for an assessment. And I will tell you, they were the most amazing 10 days of my life. It erased 7 years of unbelief, of hopelessness. To see peers working, living a life that I thought I would never live again. I remember telling the supervisor at the time, I said, if there's ever an opportunity for me to make a difference here at JTP, please give me a call. And about October, November 2007, I get a wonderful little phone call and it says, hey, there's an opportunity. And you know, I grabbed it up. And it is very amazing what that paid, the power of a paycheck. I had worked in 7 years and I was used to making pretty good money. And minimum wage was like empowering. I was like, yes, I'm working again. I'm providing for my family again. And that is the joy that we get to see here and people we get to serve.
You're right now in the drop-in center, which is the first point of contact for individuals coming straight off the streets. And they're greeted here by peer staff. So in other words, all of our staff do carry a diagnosis and have had an experience with mental health, and are in recovery and have gone through training to become peer counselors.
3 days later, I started in the peer support training class. For me, this is the longest I've ever worked in my life. It'll be 3 years this fall.
As of September 2009, the MHSOAC has approved 41 workforce education and training plans for approximately $149 million in approved expenditures. By providing services like these, California is transforming the mental health system from a fail-first to a help-first system. Today, the MHSA continues to serve thousands of clients and families throughout California. Even as other funding sources have been cut back, the MHSA has made it possible for counties to continue to provide effective and efficient services to California children and adults dealing with serious mental illness.
What we have moved toward and what the Mental Health Services Act has taken advantage of is what has been learned about a rehabilitative approach to mental illness, saying that people can recover, they can come to a new level of wellness, they can bring wholeness to their lives.
Love and calmness give me hope for tomorrow's successes. I will make a difference. I'm there.
I'm there.
I'm there.
I'm there.
I'm there.